Oral appliances enjoy a higher compliance rate than CPAP. So although the effectiveness is somewhat less or slightly less, more people can tolerate oral appliances. And I have a theory on that. The easy thing to imagine there, or a popular theory, is that if you describe oral appliance therapy to a person and you describe CPAP therapy to a person and you say, which one do you want? 9 out of 10 of them are going to select an oral appliance because it just sounds like an easier thing to do. And I think there's some of that and the reason why oral appliances have a higher compliance rate. But I don't think that's the bulk of the reason. In my opinion, the reason is follow-up. When you're managing any type of chronic condition, sleep apnea is certainly that, a chronic condition. But when you manage any chronic condition, follow-up, careful follow-up is the key component to successful treatment. Dentistry, and especially how oral appliances are administered, it requires follow-up. You can't just give a patient an oral appliance and say, here you go. That's kind of what happens with CPAP. You know, they get one session with a respiratory therapist, and then if they're lucky, they'll get a couple of phone calls. With dentists in oral appliance therapy, obviously we couldn't do that. So I think the follow-up that's required to administer oral appliance therapy is a major component as to why compliance rates are higher. We're going to introduce a good friend, Dr. Ken Berley, who is a dentist, learned in dental sleep medicine, and also a practicing attorney.
When you look at scope of practice, there's actually 3 elements of it. Number one's the state definition of the practice of dentistry. The second aspect is your educational level. For example, both general dentists and oral surgeons work under the same definition of the practice of dentistry in the same state, and yet their education levels changes their scope of practice. Obviously, oral surgeons might be qualified to do a number of things that a general dentist wouldn't be qualified to do, but yet they work under the same definition of the practice of dentistry. The third aspect is any limiting state statutes or board opinion.